Thank you, Madam President.
Senator from Washington.
Thank you, Madam President. I rise in strong support of the Protect Women's Health Care from Corporate Interference Act, and I want to thank my colleague, Senator Murray from Washington, and my colleague, Senator Udall from Colorado, for introducing this bill, and Senator Murray for her long champion efforts on women's health. So I'm very proud to support this bill. And I guess I would say to my colleague, who I know, feels passionately about these issues, that the issue is really how important prescription benefits are to women's health, and particularly how important prescription contraception is to women, and the fact that it's not an add-on to our health care, it's an essential part of our health care. So I hope it doesn't really take us getting a majority of women on the Supreme Court to convince people how central this issue is to the health care of women, and why we don't want to deal with a boss who decides to say, I don't want to cover that in your employee benefit package. So I hope my colleagues get a chance, will vote on this legislation, because I think the Supreme Court ruled in this case 2 weeks ago that really set us on a slippery slope. In a 5-4 decision, they held that corporations can deny contraceptive coverage for women who are their employees if the owner professes a religious objection. So I know my colleague thinks, well, why don't we just make this product more available so that women can pay an out-of-pocket expense for it? It's an essential part of women's health and should be part of an employee's package and not have to be something that she has to go and add on later. So this precedent by the court is a troubling precedent. The decision threatens access to critical preventive health services for women, and it opens the door for employers to deny other health care services just because of the owner's religious beliefs. Now, many of my colleagues have been down here to the floor and have articulated how this is not about the religious exemption part of the Affordable Care Act that can be sought by churches and religious organizations. This is about employers who are corporations. So those exemptions for people who do have religious beliefs and don't want to offer these health care services are still preserved. But what is not preserved is a woman's ability to say to her employer, why are you discriminating against me and my health care insurance that you're going to provide when you're not providing the full range of benefits for women? So as I said, it really is a slippery slope, and the question is how many other things are going to be thrown into this same area? Well, I'm getting lots of letters. In fact, I've heard from several people from the Northwest. In fact, this one individual wrote to me saying, I'm terrified that the affordable access, not an add-on, just because I'm a woman and I work for an employer, now I have an add-on health care because you're discriminating against what my health care services are. She said, I'm terrified that affordable access to my medically indicated preferred method of birth control may be in jeopardy due to the recent Supreme Court decision. So yes, we're hearing from a lot of people that the decision imperils the ability of women to access evidence-based, clinically effective contraceptive methods in their health care plans. And these are health care plans that they pay for through the hard wages in part of their benefit package when they sign on to work for a company. So we know that this is a vital component of health care, and it helps women from everything from family planning to the reducing risks of ovarian and ovarian cancer and other things. And so we want to make sure that these recommendations, like the recommendations of the U.S. Preventive Services Task Force, which says include productive health care methods as preventative services, we want those services to be offered. As a result of those recommendations, about 675,000 women in Washington state now have robust access to a set of 20 FDA-approved contraceptive methods as part of a preventative services package. So these services are covered free of coinsurance, free of copays, and free of deductibles. So now you're basically just saying, because you're a woman And even though this is an essential part of healthcare, all of a sudden, because of the Supreme Court decision, you might work for an employer that's going to ask you to pay for that instead out of your pocket. So I think this decision threatens real progress for our healthcare delivery system. We know this well because in Washington state, employers denying women's basic health coverage is not a new issue. In fact, a woman in my state, many of them have been fighting for decades. In 1999, Jennifer Erickson was supervising as a pharmacist at Bartell Drugs in Bellevue, Washington. Upon starting her job, she learned that her company didn't cover one prescription that she needed, birth control pills. So she appealed to the company asking them to cover that benefit. She was denied. So she went on to file a class action lawsuit on behalf of the company's non-unionized employees. In a landmark ruling, the federal district court, Judge Robert Lasnik, held that Ms. Erickson had the legal right to access birth control under the Civil Rights Act of 1964. What's more, the decision was based on a Supreme Court precedent. So unlike the district court, though, the Supreme Court has gotten this wrong, and the ruling is a dangerous precedent to allow employers to deny other health care benefits just because the owner wants to proclaim that his religious beliefs doesn't want him to offer those coverages. As Justice Ginsburg said, quote, would the exemption the court holds be used, that has been used on contraceptives based on religious grounds, would there be other examples? Like blood transfusions because they were a Jehovah's Witness, or antidepressants because they were a Scientologist, or medication derived from pigs, including anesthesia and other things, because certain other ethnic groups, Muslims, Jews, or Hindus, said that they didn't want to provide those services. So does it set us up to lots and lots of things not being covered by corporations simply because the CEO or many owners of that company decide that it's in their religious beliefs not to offer those important services? So it is very important that we vote to make sure that we speak on behalf of these women that are writing to us now, that we give them the kind of coverage for health care that they deserve, and that ensures that every employer who sponsors a health care plan has these same benefits included in the package. The good news is that for 60% of working women in Washington state, they get their coverage through their employers. But we need to make sure that the employers, just because the CEO all of a sudden now has become the judge on whether they want to cover important health care services, we have to make sure that we pass this legislation to protect those employees. So I hope my colleagues will support this legislation, and I thank the President. I yield the floor.